To show you a video of the posterior segment in which we are going to show you posterior vitreous detachment. If you have seen them, it's good, but if you haven't seen them, here is a quick look at a Weiss ring. So this is a Weiss ring, which is the attachment of the vitreous at the optic disc, and this is obviously detached from the optic disc and it has come forward into the vitreous cavity. And when you're looking at a slit lamp, what you want to do is you would need to focus. If this is your retina over here and you're focusing your slit beam over here, you need to shift your focus slightly anterior. So you need to pull your joystick for your slit lamp forward to have a look at this thing. If you're sitting here and this is the joystick of your slit lamp, you need to pull back on this and your whole slit lamp moves backward over here, and this gives you a view of that vitreous jelly, and that is going to float when you are going to move the eye as well. So let's run the video and see how it looks like in real time. And here you can see the video in the video that, let me stop this and let's play this. Here you can see, if I run it overlay on the video, you can keep seeing this area over here. You can see this posterior vitreous area of detachment, and this is moving as you move the eye, and this would look like a cobweb for the patient. He would see something which is there and it moves when he moves the eye. If he moves to the right, it moves the same side, and it will be more prominent when he's in a dark room compared, sorry, in a bright room, in a bluish background. That will give him more of that appearance of that cobweb. And the important thing is, you need to ask him, do you see any flashes of light along with it, or is just isolated and you just see a floater? If there's no flashes of light, usually that's a good sign that the retina is not getting pulled while you're getting an acute PVD. And if there's an acute PVD and this has happened for the first time, you need to call them back in 4 to 6 weeks time so you can have a look at the peripheral retina and to see for any breaks. Sometime is associated with a vitreous hemorrhage, and that is the most important part, that you need to ask the patient always to look up and down, and you mostly the breaks are in the supratemporal quadrant, and you are able to localize a break in the vitreous hemorrhage by asking the patient to look up. But this is something which is missed by the residents a lot of times, and this is something, because if this somebody's got a vitreous hemorrhage along with a PVD, he needs to undergo surgery for retinal detachment if he's got a hole, because you will see a horseshoe tear at the area of the break, and usually that area is the thing which is going to detach later on. So this is PVD, which is very important to pick up. The patients prevents with floaters and sudden onset, and it's more common in patients after trauma, after undergoing cataract surgery, but it can happen anytime after the age of 50 years at that time. So thank you very much for watching. We look forward to seeing you again in another video.